Hello, everyone. Welcome back to the Strength and Hormones podcast. I'm your host, Lauren Papanos, and today I'm joined with Dr. Cecily Havert, and we are going to talking about why muscle is really the key to healthier bones, helping prevent and contribute towards prevention of maybe things like osteoporosis, osteopenia, as well as its role in metabolic health to help with additionally supporting blood sugar regulation and help with prevention of things like type 2 diabetes, prediabetes, and such that we're more at risk of as we get older. We're really going to be talking about the relationship of these two factors, bones and metabolic health, as it relates to these menopausal years and postmenopause, and why this conversation even matters. So, what's changing during these years that really makes the conversation of bones and metabolic health be something we want to focus on? So, Dr. Cecily, thanks so much for being here and welcome to the show.
Thank you so much, Lauren. I'm so happy to be here. Thanks for the opportunity.
Yeah, absolutely. I am really excited for our conversation. And I feel like, especially the topic of bones and menopause is like not something super sexy, right? So, not something typically talked about, but such an important conversation. And there's such a hormonal aspect to this too. So, really excited to get into both of these topics and how it relates to menopause. But why don't we just first start off with a brief intro of who you are, your background, and who you work with?
Sure. So I'm actually a family medicine doctor. I have been practicing for over 20 years now. Born and raised in the Twin Cities, went to school in Wisconsin, and did my residency out here in Northern Virginia. I live in Arlington, Virginia, and work in a private practice right now. Um, I see the gamut of people, be it in family medicine. I would say that I focus mostly on adolescents and up now. I'm not doing a whole lot of pediatrics. And I've always had a really special interest in women's health. All through the ages. I think that when I was younger, I was really interested in women's reproductive health, and probably because I was one of them, and I just felt really, that I could identify. And as I've gotten older, I have really started moving towards, addressing and giving safe spaces for women who are going through menopause. Partly because I'm also in that stage of transition, and I've spent years listening to women talk about how hard it is and the suffering that a lot of them experience as they go through menopause. And it's something that even in medical school, we weren't taught a whole lot about. And I'm just really excited that menopause is having a minute. People are starting to talk about it a little bit more, and and what's happening during this time, and things that we can do to make sure that we stay healthy through it.
Yeah, absolutely. I think I've seen there's like a trending menopause moment. Yes. Menopau
Exactly. I love it.
Yeah, menopause really is having a moment, and even though
Yeah,
I'm
yeah,
currently in, like, more of the, pregnancy side of things, I
yeah.
also have, like, seen it impact so many of my patients and also, like, my mom and my
Mhm.
sister and things, and so it really is a space that needs support, that we need to be talking about, and, that I think that so many women so often feel like they're just kind of written off during this time period, but there's really so much that we can do. So,
Absolutely. I mean, it's been kind of pushed behind the curtain,
yeah,
right? And we're told
totally.
that that's not something we need to talk about. I mean, also women are made to feel that we aren't important, at this stage. You lose your reproductive prowess. So, suddenly, we aren't real women anymore. And so yeah. So I love that the conversation is shifting a bit.
Yeah, absolutely. So let's just start off by talking about the role of muscle mass as it relates to these years. So, perimenopause, I think, is a little bit less like known about term, but really, we've
Mhm.
talked about on the podcast before, really like maybe identifying as like the 8 to 10 years before that last menstrual cycle. But let's talk about what happens to muscle mass as women are going through this hormonal drop off, if you will, into menopause and then really post menopause.
No, absolutely. And when you said the hormonal drop off, I mean, that is exactly what's happening. Especially in perimenopause, it's maybe a little bit more gradual, but once women hit menopause, there is a very stark decline in estrogen, but also testosterone. We don't, when we think about women, we think about estrogen, progesterone a lot. We don't really think about testosterone, but actually there's more. We have more testosterone in our body than we do estrogen, believe it or not. And then that level also falls. So yeah, so during this time of these dropping hormones, what tends to happen is that women's body composition starts to change somewhat for lots of different reasons. But we do see a progressive loss of muscle. So that's just what happens. And in its place, fat mass goes up. And there's a lot of reasons why this happens. But the hormone drop is one of the one of the big contributing factors of all that. And it's hard because what starts to happen also is that with this loss of muscle, metabolism changes. I think you've heard women, at least I've heard women in my office complain, I've never had any problem losing weight, and everything I do, I just can't seem to lose weight at this stage. So we really see a change in that metabolic rate when muscle mass goes down, and insulin levels go up. So insulin resistance goes up a little bit, and so we tend to hold on to more fat mass. So there's a big change in body composition at this stage.
And what is it about these years that causes this loss in muscle mass to happen? Is this something that can be preventable to some degree, or is it that we're just doomed by the clock ticking?
Well, I would say that we're doomed. I mean, I think that it is a normal physiological change. And that's what I tell women. I mean, sometimes they feel like they've been hijacked by some sort of alien. It's like I do not recognize my body. Like everything that I could eat before, like I can't eat now for whatever reason. Either I don't feel well, I feel bloated or whatever. So but I mean, I would say that the big changes are related to the hormones. Now, can you do something about it? Yeah, absolutely. And I think it's really imperative that we sort of recognize that this is a normal process that happens in women, and these are normal physiological things that happen for whatever reason. One of the reasons I talk to patients about, but why fat mass goes up, and especially sort of in the truncal area, our waist circumference tends to widen a little bit as our estrogen levels go down, and as our ovaries stop producing the estrogen. Our body still needs estrogen, right? We still want to have it, and a good source of estrogen is actually adipose or fat, and because we there are hormones that kind of take the can actually make estrogen from the fat molecules themselves. And so I tell women this is sort of your peripheral or ovaries. So yeah, so your ovaries aren't making a whole lot of estrogen anymore, but physiologically our body wants to maintain that. Estrogen is a very important hormone. So yeah, there's going to be physiological changes in your body that are going to happen. But and so that's by knowing that this is what's happening, that's how we can do something about it. Knowing that we're losing muscle, it becomes imperative to hold on to it and actually build it at this stage. I don't think we realize how important it is. And I don't know. The message for women a lot of time is not, lifting weights and, getting strong. The emphasis on women a lot is being thin, right? I mean, we can talk a whole lot about the kind of the sociological pressures about being thin and everything, but we don't really hear a whole lot about women being strong. And so, unfortunately, that conversation is not as common. But I'd like to make it more common for women.
Likewise, and that's the whole emphasis behind the name of my podcast, which is Strength and Hormones, because there is strength in this conversation. And it's funny because I had Dr. Kelly Head on the podcast many months ago to talk about progesterone and
Hmm.
adrenal hormones. And one of the things she mentioned was that in patients that have higher body fat levels, they typically have less menopausal symptoms because of that estrogen contribution. There's
Right.
less of this like stark hormonal drop off that happens. So, not that necessarily it's a reason to increase body fat to support estrogen production, but just to emphasize your point that body fat is a large contribution to those estrogen levels.
Yeah, and it's a physiological change. It's a normal physiological change. I mean, it's not necessarily a wanted physiological change, but it's something that our body is doing to try to take care of ourselves, actually. So
Yeah,
if we look at it that way, it's like, oh, okay.
yeah,
But yeah.
exactly. Our body's
Hmm.
always trying to protect us. That's what I always say.
Correct. Yeah. Yeah.
Okay, and so, as we know, as we're getting older, they're seeing a natural loss in muscle mass occur, and I think the like statistic out there, which I know there's many, but it's like after the age of 30, you're losing like 2% muscle mass every year or something of that sort, right?
Yeah, yeah. So it's just, and again, it's just once we see these the drop offs of the hormones, that's actually when you see the accelerated
Mm,
loss in fat
yeah,
mass, and yeah, and so that's or, I'm sorry, the accelerated loss of muscle mass and the increase thereof of the fat mass. But yeah, yeah, it's usually even I would say probably in the 40s, but right after menopause or right when after you lose your menstrual cycle, then we do see a pretty significant drop at that point.
sure. Okay.
So it's kind of a use it or lose it type of thing. I mean, it really is. I mean, it becomes much more important to really focus on holding on to muscle mass at this stage, I guess is the
Mhm.
bottom line.
And you mentioned the role of estrogen and testosterone in this conversation. And I think that most women are familiar with the role of testosterone in muscle, or I think men and women are familiar with this,
Mhm.
but maybe not so much about the role of estrogen in muscle, more so estrogen as it relates to body fat, I feel like.
Mhm.
So, can you talk a little bit to what is the role that estrogen has in muscle loss or impacting muscle loss or I guess muscle retention, whichever angle you want to approach it from?
Yeah, I mean, yeah, it's true. Testosterone does play a role. I mean, again, like you said, that's what we usually think of muscles and testosterone, but estrogen also plays a role in it as well. And so, as estrogen levels fall, then you're also going to see the muscle mass, fall as well. From a physiological standpoint, I'm less familiar with the the kind of molecular changes that are happening, but it's just something that we definitely observe, both just with um, just in terms of even measuring patients' muscle mass, but also in just the complaints that women have with how difficult it is to lose weight, and the fact that they just tend to be gaining weight, and they tend to be gaining fat mass. So
Yeah.
yep.
Okay. And then we mentioned a little bit earlier how like the conversation of bone plays into this too. So what is the relationship between these hormones like estrogen, progesterone, testosterone that are declining with menopause and our risk for bone loss and developing things like osteoporosis?
So yeah, so estrogen kind of plays a few different roles in osteoporosis or bone loss. So one is just the direct effect of estrogen on bones itself. The lower estrogen level actually doesn't support the bones in terms of maintaining and being able to kind of build up their structure, their matrix to keep them strong. So without the estrogen, you do have more bone breakdown rather than bone building up. So you're kind of losing bone instead of building it up. So there's that piece of it. But the other piece is that, with the lower estrogen levels, like we mentioned, with the muscle mass going down, lower muscle mass, having more muscles on our bones actually creates sort of a mechanical, um, I guess it would be a mechanical pressure or mechanical pull on the bones to actually restructure and to stay strong. So there's the direct effect of losing estrogen, that's breaking down the bones. But then if we don't, then, the secondary effect of not having enough muscles to actually support these bones is kind of almost like a double whammy. So, and I think that we talk a lot, or maybe at least I talk a lot, or patients are maybe more familiar with the direct effect of estrogen on bone loss. But I don't think that we think a whole lot that the effect that losing muscle itself actually has on bone loss. So it's something to really sort of realize. And what I love about it is that we can do something about it, right? I mean, we can actually feel empowered to do something about this piece. So, which is why I really encourage women to think about doing, resistance training or weight training. I mean, at any stage of your life, but menopause, I would argue, is probably one of the more critical times to actually have a regular practice of this.
Absolutely. And I've also seen some research that with like calcium supplementation. So typically when women have osteoporosis, it's recommended that you are on mineral supplementation like calcium and vitamin D to help with that bone loss. That once those estrogen levels decline, that you can't actually deposit a significant amount of that calcium you're taking into the bone. Like you need estrogen to be able to help facilitate that process. And so I think that this is like a very common misconception out there that if you're just taking high levels of calcium and vitamin D, that you're going to see that bone loss stop, or
Mhm.
it's probably going to have some impact, but that it might not be as impactful once those estrogen levels are really declining. And so I always am explaining to women like how important it is to be thinking about these things proactively, right? Is like,
100%.
how can
Yeah.
we ensure we have adequate calcium and vitamin D levels before those estrogen levels decline, so that if it is impacted by the estrogen signaling process, that we're still able to support our bones, and that as those estrogen levels decline, we're not going to see a significant amount of bone loss occur.
Yeah, yeah, no, I think that's a really, really great point because, a lot of women will say, will do their DEXA scans, bone density scans to, measure if a woman's osteopenic, and we'll see, oh, like, oh, wow, it looks like, in these last 2 years, it looks like, the bone density is really, you're in the osteoporosis range, and they say, well, I take all my calcium, I take so much calcium, I take so much vitamin D, I don't understand how this is happening. And I mean, there's a lot at play, right? But I guess to your point, it's it there's it, it's not just calcium and vitamin D, right? And also that probably plays less of a role. It's not to say don't take it, especially if you're suffering from pretty significant osteoporosis. I mean, that definitely is part of the maintenance and making sure that you don't break bones. But there's a lot of other things we could be doing too.
Yeah, absolutely. Okay, great. Well, I want to talk a little bit more about the role of muscle and how this is playing into this variable. You mentioned resistance training and strength training being powerful tools to be able to help. Tell us a little bit more about what your recommendation is for this type of exercise. Like, say somebody has osteopenia and do they need to be doing resistance training once per week? Are we talking like every day? And then how does that differ from other types of exercise? Is something like Pilates or yoga or walking sufficient to be able to get that same benefit to muscle and to bone?
Yeah, yeah. So that's a great question. What should we be doing? How much we should be doing? And I think that I'll just start by saying, because a lot of women, when it could be overwhelming when they're maybe in their menopausal, they're just starting to go through menopause, and maybe they've never exercised before. And so, what you recommend for one patient isn't necessarily what you recommend for everybody. So I just, I really like to individualize the recommendations and sort of see where a person is, and also, their overall health, if they have cardiovascular disease, if they have diabetes, if they have joint disease. I mean, there's a lot of factors at play. But in general, what I do like people to start thinking about. So you said resistance training and weight training. I mean, there's so weight training or strength training, I should say. I mean, they're similar, but maybe you can kind of separate them out a little bit. With the weight training and strength training, I think of that as lifting heavy things to the point of really getting tired, or to the point that you can't lift them anymore. Okay, so that what you're really going to be doing with this type of exercise is building muscle. Okay, this is how we build muscle. You actually have to get to the point of exhaustion, and repetitions, and then build, and then getting exhausted. So this type of training I usually recommend 2 to 3 times a week if you can do it. The resistance training would be something more like maybe body weight. And that can be incorporated. I mean, you don't have to do one day I'm going to do resistance training, but the next day I'm going to do weight training. I mean, you can incorporate all this together. And I actually think it's probably a good idea to try to, not to, do, maybe it just what we would call interval training, right? Where you do some weight training and then you do some resistance work, but also aerobic exercise too. So the aerobic part, I think, is also very important, especially if you're looking to lose weight, which a lot of women, are at this stage, just because the fat mass, you're kind of trying to keep that at a healthy place. So weight loss is also important to women. So I would say maybe doing weight training 3 days a week for, 30 minutes to an hour if you can. But obviously, if you're just starting with exercise, it might be, just, 3 days a week of lifting heavy things for 5 minutes, and then the other day is walking. So, um, and walking is important too. Walking, there's resistance in that, but you're not necessarily going to be building up muscle if you walk. So there is a difference, but the walking and the kind of that low impact type of work does give some feedback to the bones to remain strong, but you're not going to really be building a whole lot of muscle.
Sure. And I know when I was working in sports medicine many years ago, we saw a lot of bone stress injuries because of situations like amenorrhea, where even young girls didn't have adequate estrogen production, or young men didn't have adequate testosterone production. And once the athlete was really getting into the situation where where we already knew that there was like low bone mineral density from a DEXA, it was typically advised by the doctor that they weren't engaging in much high impact things like jumping and running, because there was too much of a risk of fracture that could happen at that point, right?
Correct.
So,
Without having the muscles to protect the bones, right? And so it might be the type of thing where you could eventually get to that point once you've kind of built up, a little bit more muscle. But yeah, I think that it just shows the importance of really individualizing how you exercise and what you do, which is why it's probably a good idea to have a discussion with your healthcare provider. And also, I work with a lot of uh, you know, personal trainers and exercise specialists, because I really think that, especially for women who haven't exercised a whole lot or have other medical issues, I think that having somebody who understands those conditions and can give you safe ways to start exercising is really, really important, because you don't want to injure yourself. That's the other thing that happens as we get older. Our ligaments don't get it, we lose flexibility. Recovering from injuries is a lot harder. And so it takes a lot harder or I'm sorry, it takes a lot longer to get better if you do injure yourself.
totally.
Mm.
And I think a lot of women in this age range, they typically like more of these low impact type resistance training workouts, such as Pilates, whether it's like on a reformer or mat Pilates, at least from what
Mhm.
I see in my experience counseling patients. And I'm curious as to if you feel like that is sufficient for helping support this bone loss, or if you feel like that would fall more into the category of resistance training, where we still need some of the strength training on top.
Yeah, yeah. Thanks for bringing that up. I mean, I call Pilates, yoga, Tai Chi, kind of like the mind body exercises. They're very good. They don't really, um, I guess it depends on what you're doing in Pilates, how much resistance you've actually doing. But I think that they're important. But I think that still adding uh, weight training to build muscle is something that I think would be um, important for women. You will get the resistance work with that. What I love about those exercises too is that balance is and core. And so basically making sure you don't fall is also a really important thing for people as they get older. So I think those types of exercises are really good. And they also really, I mean, all exercise helps with the mental health piece of it too. And that's the other thing that it can be tricky this time, this transitional time during menopause, is that there's a lot of mood lability, interrupted sleep. There's a lot of other things going on. So exercise can be so good for mood. And the mindfulness aspect of yoga and Tai Chi and even Pilates can just help you feel better about yourself in general.
Totally. Yeah, I agree with that. And I think all those types of exercise have a role, and it's just knowing how to structure them properly, so you're getting the best bang for your buck in all of these different areas, right?
100%. Yeah, but, and also the other thing I tell patients too is that, it's like, "Oh, should I be doing this? What should I be doing?" And I said, "Well, the most important, type of exercise you should be doing is exercise you'll continue doing."
Well,
But something that you're not just gonna stop and start or something. So really trying to find something that you enjoy.
yeah.
And so, because if you really hate Pilates, but you just feel like it's a really good thing to do, I mean, yeah, you might do it for a little while, but you're not, if you don't find joy out of doing it, then that's probably not something you should do, and you're probably not going to build a good habit. So I love it. I love women to start. think about recreational sports that they may like to do, whether it's tennis or pickleball, kickball, volleyball. Find maybe a sport that would be fun because there's a lot of resistance, training or resistance work that comes along with doing that, and a lot of good cardio benefits too. I don't think we've talked a whole lot about the aerobic or the cardio benefits, but that's also really important for cardiovascular health. I know that we're talking a lot about muscles, but cardiovascular health is also something that's important. But yeah, find something that you love and that you know that you'll do, and then a lot of times also with these types of recreational sports is that there are other people that you'll meet that are doing them as well, and so you've got kind of a social network, and so it all just kind of builds on itself.
Yeah, I know that there was like some research that showed that tennis was like the sport that had like the greatest longevity rates with. And I think it's because with that, it is like something more recreational. Like
Hmm.
there's also community involved. You're outside in the sun. You're
Yeah.
getting vitamin D, right? All of these other variables. So to your point, I think that there's a huge impact that just those fun type of workout exercise, movements can have in your
Yeah. Yeah. Yeah.
health. Okay, so we talked a little bit at the beginning about how when women go through menopause and we see this hormonal drop off occur, that there is a
Hmm.
greater risk of insulin resistance, and that oftentimes is a contributor to some of these body composition type shifts happening. So, talk a little bit about the role that muscle has in impacting this process.
Yeah, so building up muscle in this stage is really important as you're sort of combating the decline in muscle mass and the building up of fat mass and the insulin resistance that's sort of happening when your insulin levels are high. You tend to hold on to fat. So ultimately, if if one of your goals is weight loss, just burning fat is a good thing, and by putting on more muscle we actually shift our metabolism a little bit to be burning more fat in ways that the insulin resistance goes down when you have more muscle mass, so the insulin levels go down, so therefore you're burning more fat, and so there's that process that's going on. The other positive benefits that happen when we increase our muscle mass is that there are actually hormones that are released that decrease our hunger. Basically, the hunger messages. So we're not as hungry. We don't need to snack as much. We don't sort of have that extra food noise. So that can actually change a little bit when we increase our muscle mass. And also just to speak a little bit to women who are going through menopause and are having vasomotor symptoms, the increase in exercise and building up of muscle mass can actually decrease vasomotor symptoms too, because this is something that is really really problematic for women. It affects sleep and just sort of even how we function throughout the day. So this is something that can really really be helpful.
And what would be some examples of vasomotor symptoms if someone isn't aware?
Oh, yeah, no, no, yeah, thank you for, clarifying that. So, hot flashes, I think we've heard of the typical hot flashes. So, a lot of times, just suddenly out of nowhere feeling really, really hot, your whole body can start to sweat. Sometimes, your face will turn really red. Your heart can start to race a little bit. Some women will have, 20, 30 of these a day, and, they're trying to get through their work day or trying to, like take care of their, if they have kids or, also, aging parents. We're kind of this menopausal women are sort of in the sandwich um, kind of caretaking generation where we've got, kids, but we've also got aging adults. So there's a lot on our plates. Um, when vasomotor symptoms happen at night, it can really impact your sleep if you think about it. So, you wake up constantly, hard to fall back asleep. You're taking the covers off, you're putting the covers back on. So those are the kind of the the basics of what vasomotor symptoms are.
Sure. Okay. And you see that muscle has a relationship and how significant or how frequent those vasomotor symptoms are happening. Is that
Yeah, it
correct?
can. It's interesting, and I'll just share. I am 50. I just turned 50 this past year, and I last year I started having nighttime hot flashes. So I'd wake up in the middle of the night and, I would just have to, put on a fan and that was up 2, 3, sometimes 4 or 5 times a night. And I recently really started increasing the weight training that I do. And I mean, it could just be anecdotal, but I definitely notice I don't have those problems anymore. And so it's definitely, it's not, it's not to say this is the answer for everybody, but again, it's a nice, I love having an option where you can feel empowered to do something about it. A lot of people are like, well, what can I do naturally? This is, there's the, of course, like I'm open to hormones. Hormones are, estrogen, or combined estrogen progesterone therapy is can be really helpful for hot flashes, but it's nice to know that there are other options too.
Yeah, absolutely. I know, and it's like a very great option that impacts not just those symptoms but others too, which is I'm all about things that give us the most bang for our buck. So, I love
100%.
it.
Yeah, there's so many other benefits to it as well. I love finding I always tell patients when I'm looking for medications or when I'm trying to find a treatment, I'm like, okay, what can I find that's going to treat more than one thing? I
Yeah,
want to make sure this is like worth your worth your time. And if you're gonna,
absolutely.
take this medicine, let's make sure it's gonna help a few extra things.
Yeah, totally. And you mentioned how this change can cause changes in body composition, right? So I think
Hmm.
typically, like people refer to as like the mental belly, where
Yep.
we're seeing, generally when you're during those reproductive years, you're going to see more of that body fat and like your hips and
Hmm.
buttocks area, right, and smaller waist. And then once you go through menopause, it kind of shifts, and maybe there's more weight loss happening in the lower body, but we're seeing more of that weight gain happen in the middle section. What is it that exactly is causing this to occur during midlife, and what is the role that muscle has in this?
Yeah, yeah, and I think that again, like we talked about the normal physiological changes that happen in women's bodies, right? We seem to think there's something wrong with us. It's like, oh, this is because it's unwanted. There's something wrong with us. My hormones must be off. I hear that a lot. It's like, can you test my hormones? My hormones must be off. I'm like, well, I think you're going through menopause, so I don't know if it's off. It's it's changing, and so yeah, I mean, but I think that the changes physiologically, body composition that we see in women is a lot of it to do with those drops in hormones, the estrogen, the testosterone, the progesterone, maybe somewhat too, and the sudden decline in muscle mass and the increase in fat mass, and the fat is going to physiologically why it's going to stay in the midsection. There's it's just uh something from evolutionary wise in our the human in the human beings that this is going to be advantageous to us for some reason. And yeah, and what's hard about it is that we tend to look at this as a really negative thing. Like our body changing is a really negative thing, and again kind of just kind of going back to, kind of the thin, the pressures that we have to remain thin and have a thin waist and everything. And then I really try to work with my patients, even psychologically about learning to love their body and what, with what's going on and that their body at 50 isn't going to look like what it did at 20. And that's okay. And that's actually expected. It doesn't mean that we don't take care of our bodies. And there's things that, there's certainly things we can do to make sure that we feel strong and healthy, but it's going to be different. And that's okay.
Yeah, and I think that's a really important message because there are so many changes that a woman goes through, like I'm currently going through the whole postpartum body changes, right?
Mm,
And then I know it's going to
hmm.
be the postmenopausal body changes, and there's just so many, and we just have to give ourselves some grace and knowing that like these are normal part of the process, right? There's nothing that you yourself did to necessarily cause these changes to happen, but how can we look at it from an empowered perspective of what can we do to support our health, and maybe secondarily also see some of those body composition changes as a side
Yeah,
effect of
yeah.
that.
No, I agree. I try to the message that I try to give my patients is that strong is the new thin. I guess, especially I mean, I guess that at any age. It doesn't necessarily have to be menopausal. I really just really am trying to just kind of redefine that what beauty actually is, and health at at any size, and just really trying to help women just love themselves and love their bodies a little bit more and respect and take care of them.
Yeah, I appreciate that. And you mentioned a little bit about using something like a DEXA scan to understand someone's bone mineral density. For some listeners, they might be aware of this if they've ever been told they may have high
Mhm.
risk of low bone mineral density. But that for those that aren't, is this something that you feel like could be beneficial for women to get a read on their muscle tissue levels and their bone mineral density at a certain point? And if so, is there a recommended age that you recommend testing be done?
That's interesting. I usually don't. So to talk about the DEXA scan, the way that I order it in medicine is mostly is 100% for screening for osteoporosis or tracking osteoporosis or osteopenia. And so all I'm doing with this testing is the bone mineral density. I haven't actually started tracking women's muscle mass. That's not typically something that's done in traditional medicine. I think that it can be helpful though, I'd like to actually be curious about seeing this a little bit more and using muscle mass, measurements a little bit more, as we move forward with helping both men and women probably. I mean, men and, as they age, their testosterone levels go down and they lose their muscle mass too, and they're higher risk for bone loss, um but yeah, I don't typically order the muscle scans just quite yet.
Interesting. I didn't even know there was an option to not order it with the muscle mass on there.
I At least not the one I read it. Yeah, yeah,
Yeah.
yeah. I mean, maybe there might be different machines that like that in nutrition or personal training. They probably have some different
Yeah.
machines that they use. If you, as a doctor, as a traditional doctor like I am, if you give a patient for a DEXA scan, it's an X-ray.
Yeah.
That's it.
Yeah. Yeah. I
Yeah,
hear you.
yeah.
No, and there's other types of ways that you can obviously test for muscle mass, but DEXA really is the gold standard for muscle mass. For those that like aren't aware too, you might those listening might be familiar with things like InBody or Bod Pod and things. And DEXA truly is recognized as the gold standard for measuring muscle mass. So that if you are able to potentially also look at, your bone mineral density at the same time, as well as looking at muscle mass, it can be a great way to see what is your starting measure of lean muscle tissue and then maybe where have those declines happened over time. I'm
Mhm.
actually licensed in DEXA's scanning because of my
Oh,
years of
are you?
working.
You should teach me about them.
Yeah, yeah,
You
I just
use them a lot differently than I use them, and that's what I'm saying. It depends on how, in what context you're using them. So that's great.
yeah. No, I've done so many DEXAs and bod pods in my years because I worked in sports medicine for a really long time. And so I've done like thousands of both assessments. And I've actually been published research, not in DEXA, but in bod pod testing. And um I would say that most people like you're not going to see a big change for at least like 6 months in between testing measures. So I
Mhm.
typically like some people I want to like get it done every week because with a lot of these like at home body composition methods, you do it every day, but they're not as accurate because those are bioelectrical impedance. And so they're very much impacted by your fluid intake. And so
Correct.
you
Yep.
can't use them legitimately to really track muscle. You're going to need to do like a DEXA scan first and foremost. And then really, I would say like secondary to that would be if you have access to a bod pod, that's kind of like the next best thing.
Yeah. Yeah. So I mean, and I really think that just sort of looking into that aspect of our health, I think will be important moving forward. But again, traditional medicine, which is what I'm trained in,
Yeah.
it's a slow moving practice. So
Of course. Yeah. And, it's about saving lives a lot of times in a lot of these settings, right? And so muscle is important, but maybe it's not quite as like left life threatening as low bone mineral density is. So I can see, where the importance of tracking the
yeah.
bone mineral density would come into play. But I would love to also hear too, like if you can just share from your experience with working with patients over the last 20 years, what have you seen in patients? Like, I'm sure you have some patients that are coming in that are already strength training or are already focused on muscle mass. Like, what do you typically see in terms of their outcomes in these areas of bones and metabolic health and how that muscle is playing a role in these two?
Yeah. I mean, obviously I take care of all types of patients, all types of, situations and, medical conditions. But, over the years, I've, worked with some pretty, dedicated and very active women, menopausal women, and just to see, just how they carry their health into, their 70s and even 80s. And what I see with these women mostly is risk of falling tends to really increase as you get older. And it's amazing how resilient these women have become to falling, or if they do fall, they don't break things. So I think that that's something that I really loved seeing, and just their cardiovascular health too. I mean, again, we can't control for everything with genetics and everything, but their blood pressure being low. That's the other thing, that having higher um, uh, muscle mass can also can increase your or I'm sorry, it can decrease your blood pressure. So the cardiovascular risk factors are well controlled. It can lower your cholesterol, lower your blood pressure, and so all these factors that are keeping our heart healthy also I see. And so these people tend to have the great looking cholesterol, great looking blood pressure. They're not on medications. I take their EKG and I listen to their heart. They've got a heart rate of like 50, but it's a healthy sinus rhythm. It's not, some sort of arrhythmia or something. So I mean, it really is amazing just how efficient that their body is working.
Wow. It's incredible how much exercise can have such a profound role in our health.
Yeah. 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 And the mental health piece too. I mean, that's the other piece, is just, really people who exercise on a regular basis and have that, tend to, if they struggle with anxiety or depression. I mean, it's such a great, it's probably one of the most underutilized ways to treat mood disorders. So
Mm,
it's nice to feel. And again, I keep coming back to this: what makes us feel empowered? I mean, exercising, lifting heavy things, seeing, doing something that scares us a little. I mean, even psychologically, these activities are very, very healthy for both our body and our mind.
absolutely. Yeah, I agree. Well, thank you so much for all of your insight and your intelligence, wisdom that you've provided with us today on this topic. I think it's such an important one, and I'm really grateful to for us to be contributing towards a conversation of empowerment around this subject because, like you said, there still is unfortunately sometimes messaging around, skinny is beautiful, or that that's what is going to make you healthiest, and we know that that's just not true. That muscle really has a more profound role. So tell us where those that are listening can learn more about working with you and what your private practice that you work at entails and all of those details.
Yeah, sure. So I work at a private practice in Northern Virginia, in Arlington, Virginia, called Northern Virginia Family Practice, and I also write blogs and do town halls. So we have all of the other media links on that on our website. You can go to nvafamilypractice.com, and you can find everything there if you want to kind of see or read anything more that I've done. And also, just in terms of learning more about staying healthy during menopause, I always like to refer people to the North American Menopause Society. And I think their website is menopause.org. So I think that that's also, if you want to learn more just about staying healthy, they have lots of great resources about exercise, hormones, and just anything that you could possibly want to know.
Yeah. Okay. Great. And are you licensed to see patients outside of Virginia? Or are you only working with Virginia residents?
I'm only working with Virginia residents at this
Okay.
point. Yeah, yeah, and it's a private practice, family medicine. But you guys could, I don't know if you've got any listeners in the DMV and the DC area, they want to check out our practice or check out
Yeah.
other things that we've done here. Feel free to stop on by and check us out.
I know we do. I know that we have some East Coast girls, so ladies. So
Oh,
I'm sure
fantastic! Yeah,
there'll be some listeners for sure. I'm on the West Coast, but we have people worldwide that are listening.
yeah,
So
of course, of course.
wonderful. Well, thank you so much, Dr. Cicely, and I hope you have a great rest of your day.
Okay, thank you so much. I really appreciate the opportunity, Lauren.
Of course.